What is the kidney's function in the body?
So the kidneys have quite a lot of different functions. Primarily they act as a filter for the blood, helping to remove toxins and waste products from the blood and creating urine. They're also very important in controlling your blood pressure and balancing electrolytes and actually making blood itself. So it's quite a varied set of things that the kidney does.
Why should people monitor their kidney function?
So kidney function is important because of the role that the kidney has in things like balancing electrolytes and filtering out toxins and processing medication. You need to make sure that the kidney is working right to make sure all those things happen properly. It's particularly important, for example, when you're thinking about which medications you might take for different conditions, because people with kidneys that won't work properly or won't filter out medication properly can end up with bigger problems from toxicity and further damage to the kidney if you give the wrong medications.
What causes kidney damage?
So lots of things can cause kidney damage. There is a gradual decline in kidney function as we age. That's quite a common thing to see. There are certain illnesses that will cause damage to the kidneys. There can be infections, or there can be different inherited illnesses or certain autoimmune conditions. Other major things that tend to cause problem with the kidneys are diabetes will damage the kidneys, and uncontrolled high blood pressure also causes kidney damage.
What are the symptoms of kidney damage we should be looking out for?
So one of the difficult things about kidney disease is that often it doesn't cause many symptoms, or not many symptoms until you get to a very late stage. The kidneys will keep going to a certain extent, until there is a major problem later down the line. So often there are no symptoms. When you do get symptoms, these can be fairly non-specific, so things like feeling tired, feeling bloated. Much later on you might get things like uncontrolled itching, and possibly changes in the amount of urine you're producing. So if the kidneys are particularly badly damaged, you might stop producing urine properly. But by and large, most people with an element of kidney disease won't have any symptoms at all.
Still function with one kidney even if the other one needs to be taken out?
Yeah, most people who have just one kidney have actually normal kidney function on their blood tests. Perfectly possible to survive with one kidney. That's why people can donate a kidney to someone else. Obviously, if you've just got the one kidney, you need to be extra careful about protecting that kidney.
Otherwise you're in trouble.
You are. Yeah, you've got no kidneys, then you're in big trouble.